Alberta Health says the province should be getting 3,900 of the Pfizer doses as early as next week, with about 29,000 more before the end of the year.
What we know is that the vaccine that's delivered in these first shipments must be given to people at the same site that the delivery happens at.
Needing to be stored at very frigid temperatures, the first doses of the Pfizer vaccine will be brought to Calgary and Edmonton sites.
Those who will be eligible, again, have to come to those sites for vaccine. And so we are looking at the healthcare workers in shortest supply and where there is the greatest pressure on the system to make those doses eligible, those people eligible for the first doses.
That means our most vulnerable, such as seniors in continuing care, will not be the first recipients of this vaccine.
We aren't at this point clear on exactly how long that restriction will be in place for. And of course, we're planning to be able to bring vaccine to the locations of this high risk, so those in long-term care and designated supportive living, as soon as we're able to do so.
Meanwhile, COVID-19 numbers remain high. Active cases topping 20,000 in the province. Over 1,700 new cases reported today for a positivity rate of 8.5%. 16 more people have died. 609 Albertans are in hospital, 108 in the ICU. And while this virus has taken a toll on our elderly population, it also affects the very young. A baby under a year old has been admitted to the ICU with COVID-19. The majority of ICU cases are in the 50 to 79 age range. With case numbers skyrocketing, Dr. Dina Hinshaw says the current restrictions in place are not sufficient.
If the goal is to bring our numbers down, we will need additional measures to be able to do that.
The outbreak on a general medicine unit at Rocky View General Hospital has been declared over. However, 3 units at the hospital remain on outbreak.